Today we are covering elimination management, a topic the NCLEX loves to test through prioritization and safety questions. When assessing urinary elimination, the exam will test your ability to intervene correctly. If a post-operative patient hasn't voided for 6 hours, the test isn't just asking if you know this is a problem, it's asking for your first action. The track is to jump straight to catheterization. The correct first step is the least invasive one, which is almost always a bladder scan. If the scan shows significant urine volume, like over 400 milliliters, now you have the data to justify catheterization and should notify the provider for an order. The NCLEX wants to see you assess before you act. For bowel elimination, expect questions about managing constipation in elderly or immobile patients. Again, think least invasive first. The options might include a laxative, an enema, increasing fluid intake, and encouraging ambulation. Unless contraindicated, increasing fluids and ambulation should be your initial approach. A common exam trap is selecting a potent intervention like an enema when simpler, safer options haven't been tried. For a patient with a new colostomy, assessment is critical. The exam will give you a description of a stoma and ask you to interpret it. A healthy stoma is pink or red and moist. A stoma that is pale, dusky, blue, or black is an emergency indicating ischemia, and you must notify the surgeon immediately. This is a classic "who do you call first" style question. Let's focus on indwelling catheterization, a major source of NCLEX questions. The procedure itself is a test of your knowledge of sterile technique. A common question format describes the steps of insertion and asks you to identify the error. For example, a nurse might inflate the balloon immediately after seeing a flash of urine. This is incorrect and a common trap. The correct procedure is to advance the catheter another 1 to 2 inches after urine appears to ensure the balloon is fully in the bladder and not in the urethra, which can cause significant trauma. Preventing catheter-associated urinary tract infections, or CAUTIs, is paramount. The NCLEX will test your ability to maintain the catheter system and perform proper care. Use the mnemonic HANDS to remember key prevention strategies. H is for hygiene, meaning you perform perineal care with soap and water daily and after any bowel movement. A is for aseptic insertion. Maintaining sterility is non-negotiable. N is for no dependent loops in the tubing, as this allows urine to pool and flow back into the bladder. D is for drainage bag below the bladder, always to prevent reflux. And S is for sealed system, meaning you should never disconnect the tubing from the bag unless absolutely necessary for irrigation with a specific order. An exam question might ask which patient is at highest risk for a CAUTI. Look for the patient whose catheter system has been compromised, such as one with tubing looped below the collection bag or a bag that has been lifted above the patient's waist. Finally, remember that the most important intervention to prevent a CAUTI is to advocate for the catheter's removal as soon as it is no longer medically necessary.